My name is Sofia Gruskin, and I'm the Division Chief of the Division of Disease Prevention, Policy, and Global Health in the Department of Population and Public Health Sciences at the Keck School of Medicine of USC. So we have 26 amazing faculty, and what brings us together is that everyone is working to influence the factors that improve the health of populations. And some of us work at the local level, some of us work at the state level, some of us work at the national level, some of us work at the global level, and some of us work at a mix of all of those. What's really special about our faculty is the many ways in which they each bring that experience to students in the classroom through connections to guest speakers and what it is that they teach, but also with a true dedication to bringing students in to support and to connect to their research and engage in what it truly means to do public health. We're very eclectic and interdisciplinary, but all of us in our work have a focus on equity and a concern for improving health and well-being. And that provides students with a ton of opportunities, from approaches to addressing clinical interventions, to methods to improving preventive, therapeutic, and disease outcomes, to addressing the complexities of healthcare systems, as well as the systematic, systemic, and structural factors that impact health in Los Angeles and around the globe. Our diversity is our strength, and it impacts everything in terms of our research and our teaching. So just a few examples. We have folks doing work on policy aspects of climate change and other larger societal and health systems issues. A lot of people who focus on health systems strengthening and health policy, both here in the United States, but also with partners around the globe. But it seems that a lot of people in our division do a lot of work in different ways around infectious disease. So whether it's small studies in Bangladesh on STI screening, or improving detection of childhood TB in India, or looking at the mental health outcomes for folks as a result of the pandemic in Los Angeles, in Sao Paulo, Brazil, and in other parts of the world, to work that we do with the World Health Organization, the United Nations, and national governments, and academic institution, basically on every continent. And there's a lot of work in the division around sexual and reproductive health. And that's really for all communities, from HIV to sexually transmitted infections, to abortion access, to kind of a positive framing around sexual health more broadly. And as this impacts all populations, so not only adults, but adolescents and young people, and people who face additional challenges because of limits that exist in the services that are available to them. So for folks who are transgender or intersex, or whose behaviors or identities are not yet fully supported by the law or by traditional public health programming. We have people that are working around issues around race, ethnicity, around social class, around how these factors come together and how they intersect, and the impact that this has in terms of people's health and well-being and their ability to access health services.